What is the cost of TB prevention treatment? Have you ever wondered about the cost of tuberculosis prevention treatment? Tuberculosis, often referred to as TB, is a serious public health concern. Preventing TB is crucial, especially for those at high risk, like individuals with latent TB infection. The cost of TB prevention treatment can vary significantly based on several factors. These include the country you are in, the health care system, the type of medication prescribed, and whether the treatment is self-administered or supervised by healthcare professionals. The most common prevention treatment for TB is Isoniazid, often called INH. This medication is usually taken daily for 6 to 9 months. In many countries, generic versions of INH are available at a low cost, making it generally affordable. However, the total cost can increase due to factors like healthcare provider visits, monitoring for side effects, and the support needed to ensure patients complete their treatment. Historically, self-supervised treatment regimens have been completed by only about 60% of patients, which can impact both individual health and public health outcomes. Recently, health authorities have introduced alternative regimens to improve treatment adherence and reduce costs. For example, there are now shorter treatment courses available. One option is 3 months of once-weekly Rifapentine combined with Isoniazid. Another option is for months of daily Rifampin. These newer regimens are often more convenient for patients and can help lessen indirect costs related to lost productivity or transportation to healthcare facilities. In low- and middle-income countries, the direct cost of TB preventive therapy can be as low as a few dollars per person for a complete course, especially when using generic medications. In contrast, high-income countries may see higher costs due to differences in drug pricing and healthcare infrastructure. However, even in wealthier nations, TB prevention is considered cost-effective when compared to the expenses associated with treating active TB, which requires more complex and lengthy treatment. It is also important to consider that the true cost of TB prevention includes resources for diagnosis, monitoring, and support services to ensure patients adhere to their treatment plans. New diagnostic tools, like portable assays for TB detection, are being developed to help lower costs and improve access to testing, which is essential before starting preventive therapy. Overall, the cost of TB prevention treatment is generally low when using established regimens like Isoniazid, especially where generic options are available. The introduction of shorter and more convenient treatment regimens has further enhanced cost-effectiveness and patient outcomes. However, the overall cost can depend on local healthcare systems, the need for additional support services, and the availability of affordable diagnostic tools. TB prevention remains a highly cost-effective public health intervention, providing significant benefits for individuals and communities at risk of TB. Always consult a healthcare professional for personalized advice and to determine the most suitable and affordable prevention strategy for your situation.